The following activities are the COVID-19 preparedness and responses for the 8 Misamis Oriental provincial hospitals. MOPH Magsaysay. Successful launching of the hospital's Likay COVID Tawag Konsulta, with 100% acceptance by the Sangguniang Panlunsod on Hospitals initiative to provide telephone consultation to people. Formulation of disinfection protocol for hospital, admitted patients, and the triage area with regular schedule for disinfection to prevent COVID-19 transmission. Creation of the holding area for COVID-19 suspects awaiting transport to COVID Center with coordination with Restru and RHU. MOPH Hingol. Strict implementation of minimum health protocols are observed upon entry in the MOPH Hingol premises. Misting and hand washing are necessary in following the standard procedures. Due to readily available and increased operating room capabilities, referrals to the Apex Hospital NMMC have decreased. MANCOM has initiated urgency to conduct meetings to formulate and strengthen policies, guidelines, and protocols for hospital COVID preparedness and response. To promote sustainability, the pharmacy section has been able to develop and make their in-house mixing of the isopropyl alcohol for their utilization. Engineering control has taken place to ensure safety and protection among the employees, patients, and the general public. Thus, despite the pandemic, the OPD operation has resumed, but minimum health standards have been implemented, such as physical distancing, hand washing, and using of face masks. MOPH Talisayan. In response to the limited supply of blood at NMMC and PRC, the hospital conducts bloodletting activities every 3 months to ensure readily available blood for inpatients. Regular disinfection in the hospital high-risk areas are done, such as the wards, emergency room, operating room, delivery room, to maintain a safe, clean, COVID-free institution. Employees' de-stressing activities also promote healthy lifestyle in times of crisis, like vegetable gardening. Trainings are also done, such as training the staff for possible surge of COVID-19 cases, training or echoing of staff regarding doning and doping procedures, training or workshop on swabbing. MOPH Balingasag. All employees, clients, and watchers pass through triage area for thermal gun scanning, hand washing, and fill up assessment form before entering hospital premises, with one entrance and one gate to strictly monitor incoming and outgoing clients. Installation of intubation area for respiratory case patients. MOPH Claveria. Relocation of boom gate and guardhouse to regulate and monitor the patients and watchers, and even hospital employees, from entering and exiting the hospital. The speedy construction of the waiting triage area placed strategically near the entrance so that patients and watchers can enter the hospital smoothly and orderly. All of the nurses' stations are modified to protect our frontline nurses and doctors from the deadly COVID-19. Plastic transparent barriers are placed so that there is no direct contact from the clients to the nurses and doctors. MOPH Alubihit. Installation of hand washing facilities for patients prior to examination. Installation of tent outside emergency room for SARI patients. Training of the staff for possible surge of COVID-19 cases, such as re-echoing of the doning and doping procedures. Ongoing construction of isolation building for COVID-19 patients in Misamis Oriental. MOPH Initaw. No face mask, no entry policy was implemented Foot bath and hand washing facility is installed for patients. Construction of waiting area in an open space outside the hospital. Steel barriers on chairs. Provision of POI room for COVID-19 suspects. Provision of masks, face shields, thermometer, complete PPE to hospital personnel. MOPH Mantico. Installation of triage area for consultation and admission. All patients will undergo thermal scanning and filling up of health declaration form. Installation of holding area for COVID suspect patients. Installation of plastic barriers as part of the new normal operation of the different hospital service areas. Installation of state-of-the-art COVID isolation room with audio-video teleconferencing.